She's here for Pyometra surgery, 110-pound female Rottweiler.
Okay. I will be taking a blood sample for CBC.
Okay.
To make sure that she's ready for surgery. I will now take this to the DVM.
Okay, perfect.
Well, because we have the fastest diagnostic unit in the world, we already have the blood results, and they're great.
Fantastic.
Just gonna give a complete physical exam.
Yeah.
Oh, heart rate sounds strong and steady.
It's a very large head for her body.
It is. Well, how's the patient doing otherwise?
It's good. No vomiting, no diarrhea, no change in urination or defecation. And the owners have actually followed protocol and not given her anything to eat or drink for 24 hours.
Wonderful. It's not very often they actually listen.
I know.
Blood pressure is great. And it's very nice when the owners actually follow procedures. I'm going to take a temperature now, put a little Vaseline on this, just to lube it up nice. Here we go.
Lucky tequila.
Yeah. Yeah, temperature's normal too. Yeah, this dog's beautiful, beautiful girl, eh? I'm going to check her mucous membrane. Nice. CRT. Very nice. Beautiful dog. Aw, poor girl.
I know.
Oh, you can feel how full it is in there. Well, she's ready for surgery. Let's get her in right away.
All right, perfect.
After a blood test and physical exam is performed, I will be giving a sedative, and afterwards the patient will be prepped for surgery. So I'm going to be giving a sedative now. Okay.
Okay, so now Tequila is ready to be shaved before surgery. So we'll go ahead and shave off her abdomen fur. Okay, so that's done. We're going to vacuum all the fur off. Okay, perfect. Looks like we got all the fur off in one go. Sometimes you will have to reshave the area if there is still some fur left. However, this time there is no fur left, so we can just go ahead and give this little spritz of some nice sanitization fluids. And you grab a little sanitized cloth, you fold it into a smaller square, and you go in circular motions from the inside out, making sure to cover all areas of the skin without going over any area twice. Now you will do this 3 times, just to make sure it's good. Okay.
I'm now placing the circulation heating pad on the surgery table. I'm going to turn it on, and now the dog can be placed onto it.
Here is Tequila, all shaved and prepped for surgery.
Great. I will be administering an induction agent to the patient so the animal will fall into an anesthetic state. Okay. I will now insert the intubation tube into the windpipe.
Let me hold her mouth for you.
This tube is attached to the anesthesia machine, and the gas agents are used to maintain proper depth of anesthesia. The patient is now prepped and ready for surgery.
Pyometra occurs when an intact female's uterus fills with pus. This infection will become life-threatening if left untreated. There are 2 types of pyometra, closed and open. The distinction is based on whether the pus is draining out of the vulva or not. If it is closed, the cervix is sealed, and the course of the illness is shorter and more severe. Pyometra develops after a uterus abnormality has developed, so it is usually seen in middle-aged or older animals, especially in those that have been kept intact but have not had litters.
Well, how's the patient doing?
Good?
Is everyone ready?
Yes.
Alright, I'm ready.
Ready?
Vitals are stable.
Yep.
Justine, you're standing by.
I am standing by.
Then I'm ready to make the first incision along the middle of the underside, along the belly. I'm making the first incision. Well, there's no indication of any inflammation or any abdominal infections inside the cavity.
Okay. While moving the uterus, Katherine will gently pack the sterile pads around it to prevent pus spillage. She will also take a small sample of the pus to be tested. The most common bacteria that one would find with Pyometra infections would be E. coli. This is still treated like a routine spay, so Katherine will be removing both ovaries and the uterus. The walls of the uterus are stretched very thin and are weakened by the infection.
Jessica?
There is a very high risk of tearing the uterus open or rupture.
Vitals are good?
And look at this.
Everything's normal?
We did cut this just in time. That is one very large uterus. I'm going to gently remove the uterus now and place it for Justine to measure and weigh later without trying to rupture this big bad boy. Wow, poor girl.
I know. Katherine will now clean and replace everything into the abdomen except for the uterus. It will also be flushed with a sterile solution. The incision will then be closed with 3 layers of sutures: the body wall, the subcutaneous, and then the skin.
Everything stable, Jessica?
Everything's stable? Vitals are good?
The animal will then be awakened and moved into an observation area, and the endotracheal tube will be removed from the airway. Antibiotics and pain management will be meticulously administered, and the animal will be watched closely for complications for 24 to 48 hours to check for signs of bleeding, infection, or metabolic problems.
Everything looks good here. I'm getting ready to make add the last suture in to close the abdomen. And everything looks good. Everything went well.
As you can see, this uterus was greatly inflamed.
If we didn't take it out when we did, it could have been very fatal to this animal.
We're going to make a small incision into the uterus
On 2 sides.
so that we can weigh and measure the pus inside. What? This is what could have happened had this uterus been inside that animal.
That animal is very lucky we got it out when we did.